are the chemicals which are involved in the pain transmission and how are they released. So whenever there is an injury, look here, there is a lesion, there is an injury to the tissue. So as there is injury to the tissue, there are certain chemicals which are locally released, and these chemicals will either sensitize the nerve fibers, either they will stimulate or they will sensitize. So there is two things, that is there is stimulation and sensitization. Okay, so there will be some chemicals who are going to cause the sensitization. There will be another set of chemicals who are going to stimulate the nociceptive fibers, who in turn will carry the pain sensation, and thereafter they'll follow the ascending tract of anterolateral spinothalamic pathway. So at the site of injury, you will find that histamine. So there is a chemical which is released is histamine. So where is this histamine is released from? Histamine is released from the mast cells. So we have the mast cells which is going to release the histamine, and we have 5-hydroxytryptamine which is being released by the platelets, and we have the prostaglandins and bradykinins which are being released by the cell membrane. So these chemicals, they are going to be released. How about potassium? Since we all know cell is a bag of potassium. So when there is a tissue damage here, the cells are being damaged, and so potassium will be released. Then we have blood vessel injury will be there. So there also will be some release of chemicals there. How about what is this CGRP? CGRP stands for calcitonin gene related peptide. So they are going to actually see here the CGRP and the substance P, they are actually got two functions. One, they may go to the mast cells, stimulate the mast cells to release histamine, or they will go to the blood vessels and they will cause dilation of the blood vessels, dilatations of the blood vessels. So if I have to enumerate it, we have the histamine. The histamine is being released by the mast cells. Okay. So we have the prostaglandins. They are actually the inflammatory, pro-inflammatory substances which are being released from my cells which have been damaged by the cell membranes. So we have another chemicals like 5-hydroxytryptamine, bradykinin. They are being released. And what is they all together going to do? Look up here. Histamine, bradykinin, 5-hydroxytryptamine, prostaglandin, potassium, they all are going to stimulate and sensitize the terminals, the nociceptor terminals. Okay. And as I told already, in substantia gelatinosa, we have a collection of neurons who are going to release the substance P, as well as we have the release of calcitonin gene related peptides. And what are these? These are modulators. Substance P is actually my modulator. So what is it going to do? This modulator is going to reduce the threshold for the pain. So you will have more perception of the pain. So other than having that activity, the CGRP is also having another function, that is it causes dilation of the blood vessels. So there is an increase of blood flow to the area of site where there has been increase, the site of injury. Now, this is what the chemicals are being involved in. Now, what is these are my nociceptors, terminals. Now there is going to be, now they are going to carry the sensation of pain. And this pain, the magnitude of pain, this is going to depend on to the modulators. So as you know, a note over here for prostaglandins, the prostaglandins, if we use certain substances or drugs like NSAID or aspirin, what they usually do, they reduce the prostaglandin levels, and hence what we have, we also have reduced perception of pain. That is how they act as a painkiller, or you can say pain reducing factor. So pain is not a very simple state of sensation where you give a stimulus and your receptors are activated, and these receptors convert this any form of energy which you have given, mechanical, thermal, chemical, into an action potential. Rather, pain is a very complex mechanism, as there are involvement of certain chemicals at the level of injury. So at the level of injury, the chemicals which are involved in pain transmission, to repeat again, they are histamine from the mast cells, 5-hydroxytryptamine, prostaglandins, potassium, bradykinin from the injured tissue area. Then we have the substance P from the neurons of substantia gelatinosa, and we have CGRP. So what are these their functions? They actually have two functions. One is to cause the pain, to stimulate the nociceptors or to stimulate the pain receptors. The other is to sensitize the pain receptors, kind of reduce the threshold for pain, and so more pain stimulus can be, there can be more activation of the fibers here. There can be more depolarization at this end, and so more volley of action potentials may travel along the nerve fibers and thereby ascend to the higher centers.